Hello, everyone. I am Dr. Subramanian Kannan. I'm a consultant endocrinologist at Narayana Health Bangalore. The World Diabetes Day is celebrated on November 14th, and the official World Diabetes Day 2025 theme is Diabetes Across Life Stages. I think it is very clear that the prevalence and incidence of diabetes is expanding in a very big way, particularly in the Asian subcontinent. Particularly in India, we face this challenge of diagnosing diabetes at a very young age. Now, this creates a little uncertainty about the diagnosis itself. Previously, it was fairly easy. When children get diabetes, it was type 1 diabetes. And when adults get diabetes, it was type 2 diabetes. The classifications was very straightforward. We knew there were a few exceptions, but now with the increasing prevalence of obesity in the pediatric or the children among the children, as well as because of multiple family members having diabetes, there is a fair chance that the diabetes that is diagnosed at a young age could be an early onset type 2, which could be a multi-gene or a polygene related, or it could be monogenic or a single gene related. Now, let me explain to you why all this becomes very important. When we are managing diabetes, there are two circles which form a Venn diagram, which actually decide how the diabetes is going to play out in that particular patient. One obviously is the lifestyle part, where diet, exercise, lifestyle are important. The other aspect of diabetes is their pancreatic ability to make insulin. And this ability of pancreas to make insulin is decided by genetic factors. Now, this could be a plethora of factors like a polygenic, where multiple genes are involved and we really don't have control over that. Or rarely could also be a single gene defect which could decide on the pancreatic function. Now, this becomes important because some of these single gene disorders which affect the pancreatic function can actually respond very well to a certain class of molecules called sulfonylureas. As a practicing physician managing diabetes in India for more than 10 to 12 years now, it is rather clear to me that sulfonylureas are a must in the management armamentarium in managing diabetes in the Indian population. While there are multiple new drugs on the market and variety of anti-obesity agents, I have somehow come to strongly believe that sulfonylurea forms a very important management armamentarium in the Indian patients with diabetes. Now, this may be related to their insulin secretory capacity, which could either be linked to a multi-gene problem or a single gene problem. Now, I think in certain individuals who clearly have a strong family history of very young onset diabetes and their diabetes responds very well to sulfonylureas, multiple members in the families have been managed well with sulfonylureas, is a strong clue that this could be a monogenic or a single gene related diabetes. In those cases, a genetic test could actually help us in diagnosing the case correctly, and in fact, proving that the management that we are doing is actually the correct way to manage their diabetes. The other important reason why this has to be known or why a diagnosis has to be established is the role it could play in pregnancy as well as in the offspring's diagnosis as well. So there are some cases in which managing the diabetes in pregnancy would take a little different plan if there is a monogenic diabetes. So all these factors will emphasize the need for specific patients, not all patients, but specific patients, to have a genetic testing done to decide if they have this one single gene defect that is causing diabetes. So I think the message is have your diabetes diagnosed correctly, type of diabetes diagnosed correctly. Sometimes it may be easy, sometimes it may not be very easy. And then in certain cases, Ask your physicians if there is a reason to check for genetic conditions, and if so, then what appropriate medicines should be used for your diabetes. So I would conclude saying that diabetes is a very heterogeneous condition. It's not the same size fits all. It's a very different condition, and every single person with diabetes may be very different. So knowing your diabetes well and what is contributing to your diabetes well becomes extremely important in the management of diabetes. Thank you very much.